interesting and important, and that is the herd immunity and the second wave. So I'm starting my whiteboard, herd immunity and the second wave. So let's start our discussion. I'm going to share my screen. So look, the concept of herd immunity is the following. Herd immunity is the following. So let's say we have a community where we have a bunch of people. Let's say there are 4 people. If there is no immunity to certain pathogen, let's use SARS-CoV-2 as our example, because this is actually a great example, as we did not have immunity to this strain before. So this is a new strain. It is arriving in our bodies for the first time. So we have no immunity to this kind or this species before. So let's say what happens is when the virus hits, so let's say this is the virus, when it hits one person, if there is no immunity, it is going to easily spread from one to the second to the third and so on. Good evening, Gokul. So the concept of herd immunity is just simply, so we will go to that in a second. So here we have the virus. It entered one person. There is no immunity in other people, so it very easily spread to others. Now, in case of SARS-CoV, the spread, the normal that I'm seeing from the data, the virus is spreading or doubling, and I'll explain what is the R0, doubling in about 6 days, 3 to 6 days. When the cases are increasing in a community, and then I see that the spread starts reducing to 10 days, to 13 days, and of course, finally to 0 days. So the virus has a speed index. Good morning, everyone. Thank you very much for joining. So virus has a speed index or spread index of at least this one, 3 to 6 days. And it is becoming double in that time. Hey guys, so we are talking about herd immunity, and then we are going to talk about the second wave of the SARS-CoV-2 or COVID-19. So now let's say that in this community, we have, this is the community once again. In this community, there was a person who was already infected and immune, meaning they had developed, good morning everyone. So this person had developed antibodies to the virus. So now the virus is going to come in, let's say it hits this person, first person, and then it is trying to spread, but the person next door or the person this person is standing with is already immune. So there is no further infection. And so these two people are now safe. This is the basic concept of the herd immunity. To understand this concept, good morning, everyone. To understand this concept, we have to understand a couple of things. One is R0. The second is the speed index, but I'll talk about R0 first. R0 is an epidemiological term. And what that means is that one person in a community who is infected, how many people can this one person make sick? For example, a person sick with measles can make 18 people sick. A person sick with SARS-CoV-2, pay attention to this guy, SARS-CoV-2 has an R0 of about 2 to 3. That means every one person who is sick with SARS-CoV-2 can infect 2 to 3 healthy people. And we are also seeing that this infection, hello Holly, we are also seeing that this infection is occurring within 3 to 6 days. So that's a very, very fast speed of spread. So this is a virus which is very contagious. This is a virus which is very contagious because it is spreading very fast. Now, let's say we want to develop herd immunity to SARS-CoV-2. What are our choices? Herd immunity. First, let's see what is the concept of the herd immunity. I talked about it that before, that the people who are healthy in the community or who have become sick and then become healthy, they are not going to spread the infection to further people, because as the virus enters their bodies, they are already immune, they have immunoglobulins, and the virus cannot spread further from them. Now let's talk about herd immunity for SARS-CoV-2. Let's assume that the R naught for SARS-CoV-2 is 2. That means every one person who is sick will make 2 people sick. It will make 2 healthy people sick. If we want to now make sure that we have herd immunity established, then the formula for the herd immunity is R naught minus 1 divided by R naught. That is the formula. So let's assume that the R naught is 2 in the case of SARS-CoV-2. So I'll talk about the mutation in a second. Very good question, Brandy. Great question. I'm going to talk about that in a second. So first, let's see that if the virus has R naught of 2, so let's say R naught of 2, then the herd immunity formula is R naught minus 1 divided by R naught. That would be 2 minus 1 divided by 2. That is 1/2, or 50% of the population needs to be immunized, needs to be immune. That immunity can be acquired by vaccination, or that immunity can be acquired by half of the population becoming sick. So keep this in mind. I'll do some math further. Let's assume that the R naught is 3. Then the herd immunity index is going to be 3 minus 1 divided by 3. So that is 2/3, or every 2 people out of 3, or 67%, let's say, will need to be immunized or vaccinated. So keep this in mind. I'm going to do this number now for the US. Let's say for US we want to calculate, so I'm in the US, so sorry for being selfish. So let's say for US we want to calculate that how many people need to be vaccinated. So we have about 300 million people. So 50% of 300 million is, how many are these? Of course, 50%, half of it, right? So 150 million people need to be immunized. 150 million people need to be immunized or vaccinated, or if it is 67%, then even more than 150 million. So that is the situation to develop herd immunity. How can we actually take care of people becoming immune? So one is you make them sick. So you take a person, you make them sick with the virus. This is what UK tried, and this is what I believe, I would say it with hesitation, Sweden is trying to not contain the social distancing. So we'll see what happens there. They say that we are not trying to create the herd immunity, but we are still a little bit more lax. UK had actually started off saying, we want to create herd immunity. So let's say that here is the immunity to be produced. One way to produce immunity is that make the people sick. Let them have the virus. The problem with this one is that if we make 50% of the population sick, let's say within 2 months, remember the virus is doubling every 3 days if you let it spread openly. If you allow this virus to just keep spreading, every 3-4 days, the number of people sick will become double. So within 2 months, we can actually create a 50% of the people sick. I think so. If you do the math and you think it's not, just put the right comment in there that what would be that time. So within 2 months, if we make 50% of the people, 150, let's make 100 million people sick. 100 million people sick. 100 million sick people within 2 months will mean that 14% of them are going to need oxygen and ventilation. For about 4% or 5% would need ventilation. Do you think we can provide these resources? And what would happen to the healthcare staff? What would happen to the people who are taking care of them? They are themselves going to get sick, and we would just have the whole healthcare system crash. So allowing people to become sick freely is not a wise or cost-effective way. It is actually going to kill people. Yes, we can do this. Allow people to become sick, but slowly. That is what is the concept of, take the curve and flatten it out. So make them sick slowly, and that would allow a smaller amount of people to go to the hospitals and use the hospital resources. But the question now is this. Tell me this. How are we solving allow the people to become sick slowly? We are solving that by lockdowns. So I'm sitting here in California. We have been in lockdown since 10th of March. This is the end of March now, actually April 13. So 1 month is done. So I have lost the time. And so it's 1 month now, and we have to stay in lockdown for one more, for this month as well. So 1.5 months. What will happen when we come out of the lockdown? Let's say I do not develop the disease during this time because I was in the lockdown. When the lockdown is lifted, am I never going to come in contact with someone who is sick? Don't you think that somebody visiting me or some friend or from outside California, somebody, let's say from New York, somebody comes in, are they not going to make me sick? Are we comfortable that everyone outside of our domain, our community, is healthy? One. Second, we are having infections in this community even now. So people are becoming sick. So let's say tomorrow is the lockdown being lifted, and I become sick today by getting it from someone who is, let's say, in a gas station, or who is at a restaurant. I don't want to name the small businesses. I don't want to hurt them. But let's say I am out for some essential thing, groceries, something, and somebody over there has the infection and they are asymptomatic and they gave it to me today. Tomorrow the lockdown is lifted. Am I not going to make other people sick within next 3-4 days? That is the concept of the second wave. When you have lockdown people and you lift the lockdown, there are healthy people who are going to emerge. They are vulnerable to contracting the disease. So that means just the lockdown itself is not going to solve the problem. It is delaying the problem, agreed. But that means now we need to stay in lockdown for next 10, 12 months till the 50% of our community becomes sick and we develop herd immunity. That is one possibility. And then to Brandy's point, Brandy had asked this question before. She said, wouldn't the virus mutate? So this particular virus, coronavirus, we've been looking at its mutation. It is not mutating fast enough for its core to become a different disease-causing species, just like flu does. But it is mutating. We have many, many hundreds of strains now. It has been mutating. Maybe, Brandy, it may actually end up mutating so much that the immunity will become useless. We don't know that yet. But let us assume for our discussion that virus will not mutate. But even then, when we come out of the lockdown, we don't have the immunity. And anyone who has the virus or is shedding the virus at that time will give anyone who comes out of lockdown the disease. And there is no guarantee that people who are coming out of the lockdown will not have the disease, because within the community, there may be spread going on, and there may be people who are infecting each other like 5 days before the lockdown. and you lift the lockdown, and then the sixth day people are symptomatic, and now they're going to go and spread it again, and that is a second wave. So what is the solution? Do we stay in lockdown for next 12 months or 18 months? So solutions, let's look at the solutions. So one is you make everyone sick, either rapidly, which is totally not possible, or slowly, which we are doing, but this is really, really counterproductive at the end. Economy is crashed, people are not able to do their work, and we still have people who are sick. So what is the other way then? The other way is vaccinate everyone, or 50% of the population. And I have done a detailed discussion about the vaccination. I don't want to go in creating the vaccination strategies here, but let's say we have vaccination, and that makes the people immune. So now we have to wait for the vaccine. We do not have vaccines that are tried and tested. We do not know which vaccines are safe. So we have no clear idea that the vaccine are going to work right now. They may work in 12 months, they may work in 6 months, but at this time, during this lockdown, till the end of April, for example, we won't have a vaccine that we can say, all right, give it to everyone in the US, or everyone in India, or Pakistan, or Sweden, or whatever other countries. Okay, so this is a good vaccination, is a good option as long as we have the vaccine. Okay, what else can we do? We can do one more thing, and this is, you will not hear from others. This is Mubin offering this. We offer prophylaxis. We offer prophylaxis. So in case of prophylaxis, for example, again, this is not tested fully. There are no studies available. I am using the data, anecdotal data from the people's observation, French study, then Dr. Zelenko in New York, and many, many other doctors who are saying, all right, give hydroxychloroquine as prophylaxis, then maybe add zinc, maybe add vitamin C, this is me, but add vitamin D, maybe quercetin. So a bunch of possibilities which have been somewhat successfully tested. Some doctors have come out and said it's useless. I was listening to a doctor from ICU yesterday, and he has been managing patients, and he said, I don't take hydroxychloroquine because I don't believe in it. So there are some doctors saying, no, I don't believe in it. And there are some doctors who are saying, we have treated patients with this regime, and it has helped them not become sick. And guys, if it has helped them not become sick or go to emergency or die, that means it at least made their body enough strong to allow the virus to come in, and then their immune system respond to it. It actually stalls this formula. It actually stalls the replication of the virus. It slows it down in us enough that we have a chance to develop immunity. So prophylaxis is another way. And again, not everybody is, it has become political as well. Within the medical community, it has become an issue. Some doctors are saying we cannot do it without the studies, which they are correct in saying that. Some doctors are saying we cannot have the studies right now, so do what we can do. So I like Dr. Zelenko's model from New York. What he's doing is he's saying that in my outpatient, when I receive a patient who has mild cases, if he says when I receive people who are young without comorbidities, I don't give them this. I just ask them to go home, take paracetamol, stay at home, and wait it out. But if there are people who he feels that they need management, and they are kind of in early moderate stages, or early mild stages, he gives them this. And he says that the video that I watched, he said 699 patients, they were all in the mild stage. None of them proceeded towards becoming serious or dying. And so these are 699 people who now have immunity. So prophylaxis is another choice. And there is so much mess in this discussion. It has become political. People have taken this drug in incorrect doses. People have died. That has become a proof for those who do not want us to do this, to say, look, people have died, and if somebody died, it is your issue. And so it has just become a mess. I actually believe that we should do prophylaxis. What is the benefit of prophylaxis in this case? Benefit is that instead of us becoming slowly infected, we will allow the virus to become slow in our bodies while our bodies become immune to it. Okay, so this is one more way. There is one more way that Germany is doing, which is very interesting. What they are doing is they are going to start, or there is a proposal. I do not know if they have approved this proposal or not. Their proposal is to start testing people, community in general. So let's say I live in Cupertino. Yeah, they come to Cupertino and they start testing people there for SARS-CoV-2 and start giving them certificates of, hey, you are good, you have immunity, you have antibodies, and you can go out in the society again. You can go out, you can work, you can do stuff. I have concerns about this, but here the proposal out. Their proposal is that at least let's start looking at the community. If, for example, they go to Cupertino, my town, and they say that 40% or 50% people are already infected or they have immunoglobulins in them, then they can say Cupertino town can open up because they have reached the potential of the herd immunity. That still doesn't mean that the people from Cupertino will not go out and make others sick, but at least Cupertino is now safe. Or they can come to Cupertino and say, hey guys, you guys are only 10% infected people, so these 10% can go out and work, the rest of the people stay indoors. So this is Germans' way that they are trying to figure this out. So I'm going to reduce my speed of presentation and just once again recap it. The recap is this: to develop herd immunity, in case of SARS-CoV-2, we need either 50% or 67% of the people vaccinated or contracting the disease and then recovering from it. That is one. Second, to do that, we can either make people sick. We can allow them to, all right, guys, go become sick, meet with each other, become sick, and develop immunity. But that would have huge death toll, and that would have huge stress on the medical system. Then we say, all right, let's make it slow. Let people become sick, but slowly, and that is what lockdowns are trying to do. And then eventually we have to come out of the lockdowns. What would happen then? Then is the vaccination. So vaccinate. So we have to wait for the vaccines. Maybe we can get the vaccines very soon. Maybe next month we have vaccine and everybody starts getting the vaccines. Hopefully the virus does not mutate and our immunity stays there. Then is a prophylaxis. I believe in this prophylaxis, but this is not a prescription for anyone. People can die with this, so please don't listen from me and go and do it and then harm yourself. This is an educational and discussion with my medical colleagues here so that we can develop our opinions. So prophylaxis, hydroxychloroquine, zinc, vitamin C, vitamin D, quercetin, and in moderate cases, add azithromycin. Again, azithromycin not to be given in pregnant women, hydroxychloroquine not to be given for people with heart conditions, people with retinal issues, and people with blood pathologies. Then if azithromycin, if person is still sick and moving towards seriousness, then there are many other antiviral and other management processes that are needed. And then finally, one more way to open up the society back towards working is what Germany is proposing. They haven't done it yet, is to start testing and giving the certificates. My hesitation with that is that you give the certificates and all of a sudden you give the certificate and all of a sudden some people have the certificates, they can work and earn, and the others do not have the certificates. And so now there is a class system within the society until the herd immunity develops. So interesting idea. We would love to see what happens, but this is the position. Now the second wave, I talked about it again in messages here in this discussion. Second wave is that when you lift the lockdown, healthy people are going to become sick again. You're not eradicating the virus forever. Somebody is going to come in with the virus, or somebody from within the society would still be carrying the virus and giving it to others. So that is the discussion I have today. I hope it is thought provoking. I hope it allows some sort of thinking. Kevin says because the size of SARS is quite bigger than flu and HIV, it doesn't have some proof checking mechanism. Yeah, let's see. More effective than flu. Correct. So because Kevin is saying that because the size is bigger, hopefully it won't mutate that much. So good. Any questions before I stop? And tomorrow, I was thinking I had a very important topic to discuss. I wanted to discuss some of the things that Sweden is doing and US is doing and India is doing and Pakistan is doing and China and South Korea. So if you like, we can do those, or please suggest a topic. Has this made sense? The idea of R naught or the herd immunity, for SARS-CoV-2, it is 50% or 67%. Then how do we achieve that herd immunity is the problem. If we let people become sick rapidly, then we'll have a lots of death toll. Medical facilities will be under stress, and more importantly, medical staff will be under stress, and they would contract the disease as well. I am on the side of the medical staff. We shouldn't do this to them. If we make it slow, as we are doing it with lockdowns, then eventually lockdowns have to be lifted. What would happen then? Then there is prophylaxis, then there is vaccination, then there is certification of health. So these are various ways to see how can we come out of the lockdown. If we do not do something, we would stay in the lockdown forever. 12 months, 6 months is forever for me. And that can crash economies. It would destroy lives. So we need to figure out a way to come out. Any comments? So there is a question that is second wave really a serious issue? What do you think? So let's say we are here in this town, in Cupertino. When the lockdown is lifted, if we do not have herd immunity developed or vaccination, we'll become sick again. Suzanne is saying, thank you. So guys, thank you very much. And we will continue tomorrow, 6 o'clock again, Pacific Standard Time. We will meet here and we'll continue our discussions. I hope that you are becoming smarter about not only just the COVID-19, but generally about the medical concepts. And we are developing a more rational way of understanding, more logical way of understanding things instead of rumors. My basic reason for doing all of this was to kind of prevent rumors. So there's a question, well, the only people here in Australia that are only allowed to be out at the moment for essential services, of course. So this is happening in many, many places. The question is, how long can we do that? And when we are allowed to go out, is everybody going to be safe? Aren't there going to be people? Imagine if I get the disease today and I do not show symptoms for the next 7 days, and then the lockdown is lifted during that time, and now I'm infected and I'm going to make other people sick. So there are many such complexities that need to be looked at. And we have talked about the solution in detail. Give me your comments. Tell me, what do you think? How can we come out of it? I believe in make people stronger. Give them prophylaxis. If you cannot give them vaccination, give them prophylaxis. Let them maybe try it in a smaller community. Maybe try it in a outpatient area where there are people just like Dr. Zelenko, where there are people who are mildly infected and they're positive. Maybe give them the medicine and see the outcome, and then scale that to the community. Or maybe figure out a vaccine that can quickly be used. So there are some ways. We are not out of options. I think we are out of decisions. So thank you very much, guys, for your time. Nice to see you. Thank you very much for the day off yesterday. I enjoyed it. Went out on empty roads with my wife and just had some fun drive time. Then I slept a lot because I didn't have to prepare for any lecture. So thank you for that time, and thank you very much for joining. We'll talk to you guys tomorrow at 6 p.m. Bye-bye, guys.